Welcome to the Beverly Hills Plastic Surgery Podcast. I am Dr. Jay Calvert, and I'm here as a very proud associate of Dr. Millicent Rovelo to make a very big announcement. Do you want to know what that announcement is, Dr. Rovelo?
I would love to know what the announcement is. What is it?
My incredible co-host has a TV show coming out on October 29th of this very month on TLC.
I sure do. We are super, super excited. Yay!
What's it called?
It is called About Face, and it airs on TLC October 29th. So everybody, mark your calendars.
Mark your calendars, and you gotta watch it. You gotta stream it. You gotta comment and like and everything.
Yes,
we need support. This is a big deal.
We need season 2.
That's right. If we want to get a second season for this amazing surgeon, we're going to need some eyeballs on this thing.
Yes. So I am super excited about this show. I will say it's been a long time in the making. So the fact that we are seeing it air on TV feels like the end of a very long run, and we are incredibly excited about it.
So what is the premise of the show? Tell us about it. Like how does this work?
So the premise of this show is that we are taking care of patients who have some kind of facial difference. And that could be something that they were born with, or it could be something that was acquired through an accident or a trauma or a burn. So I'm not, without giving out any spoilers here, but these are patients that, a lot of them have already been treated in the past with other surgeries or treatment modalities, but they still have some remnant of a facial difference that just bothers them. And so, we have some patients that have tumors, others that have birthmarks, others that have been in car accidents, others that have been in burns, others that have nerve injuries. So there is something that is very noticeable on their face that really bothers them. And so they're bringing in myself. There's 2 other doctors on the show as well, Dr. Jason Rustine, as well as Dr. Andre Panosian. And the 3 of us together will tackle these cases and do our best to fix them.
Well, they chose good surgeons. I didn't make the cut, but that's okay. It's awesome for you all because, the cases, a lot of them you did in the surgery center, so I knew about them, and they're pretty they're unbelievable.
They're big deal cases. Jose, our tech, was talking even today. He's like, Doc, that one case, oh my gosh.
Yeah, you got to see the show. You have a trailer on your Instagram, right?
Yes.
On the Rovelo Plastic Surgery account.
Instagram, yeah.
So go to the Instagram, check it out. I'll put it up on my TikTok. I'll put it up everywhere so that everybody knows. But you got to check out the show. It's very cool.
The show is very cool. And what I really liked when the trailer came out, once TLC released the trailer, were the comments that people were leaving. And it was basically like, so glad to see a plastic surgery show, that has like real problems or like, I hate to say, these are what the comments are saying, like real plastic surgeons treating real problems. Because, and I've said this before, unless you yourself or someone has had the misfortune of being in a car accident or a burn or having some kind of injury, you don't always know what the other side of plastic surgery is, the reconstructive aspect of it. So much of what even you and I put out there on the podcast is the cosmetic part, and that's the part that the world typically sees, the boobs and the butts and the faces and all of that glitz and glam, which is fun and fine. But there actually is this whole other world that we do with reconstruction. So much of what we do is reconstruction based. And so I think having a glimpse into that part of our world is really helpful. Yeah,
I mean, I've never even thought of myself as like an aesthetic surgeon. I do lots of aesthetic surgery, but my whole background is in reconstruction, and I still do lots of cases that would make people go, whoa.
Right. No, you definitely do.
I mean, I take some
your
stuff
noses
that is
and faces.
Crazy stuff. But this show will highlight that, and it's how we're trained, it's what we do, and it is a big part of plastic surgery to do facial reconstruction. It's kind of our bag.
Yeah, it's kind of what we do. We take face call every 3 days coming up through residency and doing all the facial fractures and the facial laceration repairs and the nerve repairs. So it's very much in our wheelhouse of what we do. And the show really is it's really not about us, the plastic surgeons. It's really about the patients and their stories. We're kind of just there as the people to come along and offer some help or some surgery for them. But the show is really geared around who these patients are and what they've been through and what their stories are and what they're looking to achieve. And I think one of the coolest things or one of the interesting things that I noticed about most of these patients is that they really weren't looking for perfection. A lot of them were quite comfortable, very confident in their appearance because they've had to deal with it for years, and some of the issues that they were dealing with have been their lifelong. So a lot of them had developed a really amazing just sense of who they are and core strength and confidence. But oftentimes there was just one thing that bothered them. I can't breathe out of this side of my nose, or I can't close this eye, or I can't, there's this one thing out of all of these things on my face that really bothers me. And if you could just fix that one thing, I'd be actually pretty good. And so it's a different way of looking at sort of a before and after reveal. You think of like befores and afters, and you think of the swan, and all of a sudden this like, reveal. And it's like these patients aren't looking for that. They're looking because they have, there's a little something that really bothers them. And if you could fix that, like that's a big deal.
I want it to be better.
Like if you can't close your eye and you're constantly having dry eye and eye trauma because you can't close your eye, and then one day someone comes along and helps you close your eye, that's a life-changing thing,
It is.
no matter
absolutely.
what else is going on the face.
No, and the stuff you did on there was very cool. So I think, everybody go look at the trailer. Do you know what time it's airing? I mean, TLC.
TLC.
It's a big deal network.
It's a real show. It's 10 p.m. Eastern, so 7 p.m. Pacific.
Nice.
Yeah.
That's a good time slot.
Yep. So TLC has an app you can stream. You can also stream it on YouTube Live, and I also think there's the Hulu Premium. You can also stream TLC on. So there's plenty of options and ways of viewing it.
I'm sure my kids have made sure that we have all of those things. So I will definitely have it. I'll record it, make sure I see it, and it'll be good. But yeah, I think it's just great news. It's awesome that you did all that work and this show is finally airing. Because, you guys made the show a while ago.
Yeah, you'll see when you're on the show, my hair is a lot shorter. Like, it was a while ago.
Yeah.
But, it came during a really strange time. It was sort of just coming out of the COVID years. Like, there were times, like, I had to do COVID tests throughout the whole, filming of it. People were wearing masks. And then, right around then, this is such like an LA story, right? But, Discovery and Warner were all merging together. And then there were strikes. And, the whole industry got really weird for a good 2-3 years.
Oh, yeah.
And so that's why it kind of was just put on the shelf for a little while. But a lot of that's now calmed down, thank goodness, and they're able to sort of get back to their regularly scheduled programming.
Yeah, I think, TV shows are starting to make a comeback a bit more. And, I don't know. I always think it's great that there's a plastic surgery show on some network somewhere. It's always good for plastic surgery in general. Interestingly, there was a time after Extreme Makeover and The Swan where plastic surgery wasn't on TV, and even Dr. 90210 disappeared in the U.S. The Dr. 90210 still airs in 100 countries around the world in every language anyway.
The original cast?
Yeah, with Linda Lee and Jason Diamond and everybody, and they still get loads of patients because it's still on TV all the time. And I think it's just great that this will really highlight your skills, what a great surgeon you are, and I think it'll be awesome. It's great to talk about the side of plastic surgery, and it is what we do. And congratulations to you and the crew. And Jason and Andre are great friends and amazing surgeons, both of them.
Yeah. Oh, amazing.
Yeah. What a great cast of surgeons for this type of a show too. Right. Andre's craniofacial trained. Jason is real expert, and he did a aesthetic fellowship and a micro fellowship. Yeah. It's amazing. Really good surgeons, great people, and you're on it. So everybody's got to watch. If you're a fan of this podcast, you need to be a fan of the show. About Face on TLC. It'll be on at 7 p.m. in our time zone.
Pacific. Yep.
Yeah, 10 p.m. if you're in the eastern part of the country, and October 29th, we got to have the watch party.
It's going to happen.
I will be there. It'll be great. I'm really looking forward to it.
Yay.
Well, congratulations, Dr. Rovelo, and this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.